Good morning, everybody. This is Nurse Eunice with Florida Training Academy, and we're going to get started in about 45 seconds. If this is your first time viewing, if you'll go ahead and put your name and where you're viewing from. Are you in the US? Are you in a different country? I promised the viewers yesterday that I would not, that I'd post, but I wouldn't go live. But I just found it was easier to go live this morning. So for you all, yes, I misquoted last night. We do have part two that's showing right now. And I didn't notify you in advance that it was live, but I'll be back live next week for sure. So everybody, let's go ahead and start. Number 26, when a resident is expressing anger. Good morning, Evelyn. The nurse aide should A, correct the resident's misperceptions. B, ask the resident to speak in a kinder tone. C, listen closely to the resident's concerns. D, remind the resident that everyone gets angry. All right, we'll reveal the answer in three, two, one. You're going to listen closely to the residents' concerns. Active listening, as far as a healthcare provider is concerned, is we listen. And so, if you can help the person, maybe if she's telling you something that you know that's beyond your control, you can notify the nurse. But sometimes just being a listening ear will help resolve a lot of those patients' problems. Number 27, when given a back rub, the nurse aide should A, apply lotion to the back directly from the bottle, B, keep the resident covered as much as possible, C, leave extra lotion on the skin when completing the procedure, or D, expect the resident to lie on his or her stomach. And I know we're here early, so we don't have a lot of our normal viewers who chime in. But if you want to participate, you can just put your answer in the chat. All right, and so we're going to reveal the answer in three, two, one. You're going to do B. You're going to keep the resident covered as much as possible. That is right. Good morning, Alicia. That is correct. Keep them covered as much as possible. So usually when we're giving them a back massage, you don't want to just put cold water directly from the lotion bottle onto their back because that'll be a shock to their skin. So you put the lotion in your hand, you warm it up, you have them on their side with their back area exposed. Keep the rest of their body covered because they can get cold. And plus, you want to maintain their privacy. So B is the correct response for this one. Number 28, the nurse aide finds a resident licking in the refrigerator at the nurse's station at 5 a.m. The resident, who is confused, explains he needs breakfast before he leaves for work. The best response by the nurse aide is to A, help the resident back to his room and into bed. B, ask the resident about his job and if he is hungry. C, tell him that residents are not allowed in the nurse's station. Or D, remind him that if he's retired from his job and in a nursing home. It's 5 a.m. Your residence in the refrigerator. Do not give me an answer that does not address hunger. And so I'll reveal the answer in three, two, and one. You all, the answer is B. Sometimes your confused patients have moments of clarity. So this confused person is in the refrigerator. He may actually be hungry. And if his diet allows, go ahead and address his hunger, feed him something. You don't, sometimes these patients are early risers and you can just ask him about his job. Whenever they have late stage dementia or Alzheimer's, you are not feeding into his hallucination or his illusion by asking him about his job and making sure that he has food that morning. 29. Which of the following is true about caring for a resident who has hearing aids? A, apply hairspray after the hearing aid is in place. B, remove the hearing aid before showering. C, clean the ear mold and battery case with water daily, drying completely. That's above my pay grade. I don't even know what the what the battery case is, how to get into it. So we know C is not the option. D, replace the batteries weekly. Hey, Miss Three Blessings. Hey, Alicia. Yes, you all are correct. We're going to do B, we're going to remove the hearing aid before showering. And so the same type of cup that you put the dentures in, have one of those cups for the hearing aids. Put a patient label on it and then mark it hearing aids. And if the person has two hearing aids, make sure that we know that there's supposed to be two hearing aids inside of this cup so we can make sure that we take care of the resident's items. 30. Residents with Parkinson's disease often require assistance because they walk, because they A, become confused and forget to take steps without help, B, have poor attention skills and do not notice safety problems, C, have visual problems that require special glasses, or D, have a shuffling walk and tremors. All right, revealing the answer. Yes, yes, three blessings. For the CNA exam, there's not a lot of math. You may have a few conversions, but it is highly possible for you to pass this exam if you are terrified of math. And you all are correct with your responses. The answer is D. Whenever someone has Parkinson's, and don't start mixing diagnoses, you will act like somebody who has Parkinson's is demented. They can still answer questions. You just have to ask one question at a time and give them a chance to respond because their speech is slow. Sometimes they have like this repetitive speech pattern. But another telltale sign of Parkinson's is that they have this the way they walk is kind of hunched over and they don't really lift their feet. They kind of shuffle them on the floor. 31. You're welcome. Three blessings. A resident who is inactive is at risk of constipation. In addition to increased activity and exercise, which of the following actions help to prevent constipation? A, adequate fluid intake, B, regular meal times, C, high protein diet, or D, low fiber diet. They're constipated. You got them up and moving. Great job, CNA. What else do you want to reinforce? Yes, that's correct. It is A, adequate fluid intake. And so, of course, water, that's the best source. But something else we could use, and as a CNA, I always want you to ask the nurse's permission before you give someone prune juice. But prune juice will help stimulate a bowel movement. Well, Eunice, prune juice is natural. Why should I have to ask the nurse? Because it's naturally high in potassium and it's also naturally high in sugar. So you'll be fixing one problem and causing another. So if a patient has diabetes and we're giving them prune juice, that's going to spike their blood sugar levels. If a patient's on dialysis and their kidneys can't excrete that extra potassium and you're giving them prune juice for a bowel movement to help promote a bowel movement, we can actually cause them to need dialysis before their normal treatment days. So when it pertains to prune juice, ask your nurse first. 32. A resident has an indwelling urinary catheter. While making rounds, the nurse aide notices that there is no urine in the drainage bag. The nurse aide should first A, ask the resident to try urinating, B, offer the resident fluid to drink, C, check for kinks in the tubing, D, obtain a new urinary drainage bag. Hi, Caroline. We don't offer international courses, but we do have those who, if their family hosts them and they can actually come to Florida, we'll be more than happy to assist you because you have to have a social security number here for the United States, and you have to be able to work in Florida to obtain a Florida CNA license. And yes, 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 great job. It is C. You're going to check for kinks in the tubing. Your patients are Houdinis. They wrap those catheter tubings. They're around their legs. If they're obese, they can actually kink the tubing with their body weight. So if a person has a catheter, by default, just automatically assume that they produce urine unless they're end stage, unless they're about to pass, die, or expire. So if they're drinking, if they're taking in any fluid, we should see about the same amount of fluid in that drainage bag within an hour. So if you're looking in that bag and it's empty and it hasn't been recently emptied, more than likely there's a kink. So go and check your tubing placement. 33, a resident who is incontinent, you're welcome, Caroline. A resident who is incontinent of urine has an increased risk of developing A, dementia, B, urinary tract infections, C, pressure sores, or D, dehydration. This one's hard. Let me repeat it. 33, a resident who is wet with urine. Incontinent means that they cannot control their urine and they seep it out. So a resident who is incontinent with urine has an increased risk of developing what? Revealing the answer in three, two, one. You are so close. The answer is C. So the reason why it is not urinary tract infections is because usually that's going to happen when a person is retaining urine or if they're sitting in fecal matter or if they wiped improperly. So if a person's wet, remember incontinence mean they can't control their urine, so their skin is wet. If the skin is wet, they're going to be at an increased risk of developing pressure sores. And one of the first stages would be, what we call a baby, a diaper rash, but your residents can get that also. And so whenever you notice an alteration in the skin, please notify your nurse. We'll provide incontinence care promptly, meaning that we don't let the patients lie in that moisture. And then we can use barrier creams also. 34. When cleansing the genital area during perineal care, and I want you to read that word with me, perineal. I say it as if it's two first names. Some of your foreign-born nurses will say perennial. Regardless, don't say it to a patient. If you don't feel like explaining it, don't say it. So I'm going to repeat this as if I'm talking to a patient who doesn't know what it means. When cleansing the genital area during vaginal care, okay, or it could be just the area that's wet if they wet themselves in the bed. The nurse aide should A, cleanse the penis with a circular motion starting from the base and moving towards the tip. That would mean where the sweat, where the hair is, you're going to clean there first and then bring the washcloth up to the top and clean the meatus or the head of the penis. That's nasty. B, replace the foreskin when pushed back to cleanse an uncircumcised penis. Well, what do you know about uncircumcised penises? That's that extra foreskin. And whenever we pull that foreskin back, especially if this person has not been maintaining proper hygiene, there's schmigma beneath it. That's like yeast, dust, lint. So it's like the head of their penis is like white. So whenever you pull that foreskin back and you see something abnormal, try to clean it, but then also notify your nurse. Or is it C? Cleanse the rectal area first. And we never clean the dirty area first, so we know it's not C. And then D, use the same area on the washcloth for each washing and rinsing stroke for a female resident. Every time you wash a female's private area, I want you to pretend that she is on her menstrual, that she is on her menstruation, or that she's on her period. And so if you wipe down, you're going to have blood on that washcloth. You have to change spots in order to prevent from recontaminating her with the blood. I use I use blood so you can see this in this imaginary scenario, but what you'd really be reintroducing to her vagina would be fecal matter. So with a female resident, every time you wipe down, you have to change spots, just like you would with toilet paper. So I did a lot of talking for this one. I want to prepare you for this next image, you all, because I had to find the best image of an uncircumcised penis that would not get me booted off of YouTube. There you go. B, replace the foreskin when pushed back to cleanse an uncircumcised penis. So you all, whenever someone has that excess skin, these are just, corn dogs. But whenever someone has that excess skin, you want to make sure you retract it or pull it back. Start cleaning at the very tip of the penis. Work your way down towards the base. Don't forget that old men's testicles are not nice and firm. They hang down low, so make sure you pick them up and clean beneath them. And when you're done washing and rinsing, please pull that foreskin back over so that it covers the penis. Yes, 3 blessings. I'm not getting banned this week. I already got one warning. 35. Which of the following is considered a normal age-related change? A, dementia. B, contractures. C, bladder holding less urine. Or D, wheezing when breathing. What is normal? I'm revealing the answer in three, two, and one. All right. So as we get older, our muscles get weaker, and the bladder is a muscle just as well as the heart. So these muscles are going to get weak. Just don't think about triceps and biceps. Think about those organs also. And so it's important. We know that their bladders are going to hold less urine. So when those patients call you and they have to go to the bathroom, please, put a little pep in your step and get to them a little quicker. All right, and if this is your first time tuning in and you haven't subscribed, please go ahead and subscribe. My name is Nurse Eunice. I'm the owner of Florida Training Academy, and I've been training CNAs for 15 years. I train CNAs actually to become nurses. So I trick you. I say, hey, come take the CNA course. And then I'm like preparing you, putting little seeds in your head so that you can become a nurse or an entrepreneur. And so I hope that I'm getting that across this morning. All right, so next one, 36. A resident is on a bladder retraining program. The nurse aide can expect the resident to A, have a fluid intake restriction to prevent sudden urges to urinate, B, wear an incontinent brief or an adult diaper in case of an emergency, C, have an indwelling urinary catheter, or D, have a schedule for toileting. We always do least invasive. So we're not going to put a catheter in somebody because they're wetting themselves, unless it's a medical emergency or a medical reason. So you are correct. It is D. 3 blessings. You're ready for your test. Have a schedule for toileting. Bonus points. I don't have any chocolate or any gifts to give you. What's wrong with this picture besides the fact that there's urine on the floor? So it looks like we have a patient who's on a bedside commode that doesn't have a pot to catch the urine. But what else do you see wrong with this picture? It's definitely a fall hazard. The patient's up without the skiddy socks, the socks that have the little skids on the bottom. So, and they're up without footwear. So we never walk a patient without the proper footing because, of course, there's urine there. She's going to slip and fall on that if we don't clean that up. But just the fact that she's walking barefoot alone is a fall risk in itself. 37. A resident who has stress incontinence, A, will have an indwelling urinary catheter. B, should wear an incontinent brief at night. C, may leak urine when laughing or coughing. D, needs toileting every 1 to 2 hours throughout the day. Incontinence, they leak. Stress incontinence, there's pressure. Think about somebody when they're pregnant, the baby weight. There's pressure on top of the bladder, which causes them to leak urine. So you are correct. You're correct. Great job. The correct response is going to be C. They may leak urine when laughing or coughing due to the additional abdominal pressure. 38. The doctor has told the resident that his cancer is growing and that he is dying. When the resident tells the nurse aide that there is a mistake, the nurse aide should A, understand that denial is a normal reaction, B, remind the resident the doctor would not lie, C, suggest the resident ask for more tests, D, ask if the resident is afraid of dying. The cancer is growing. How will we know it's growing if we don't have tests, to show it at a smaller stage or results? So the cancer's growing, this person's dying, they tell you there must be a mistake. Yes, 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 yes. Great job. I'm so proud of you. You understand that denial is a normal reaction. Okay. Just keep providing your care. We can help get case management. If the person needs hospice, we have different consults that we can call, but you just keep being a great supportive CNA. And we're not going to fuss with this person because denial is a normal reaction. 39, a slip knot is used when securing a restraint so that A, the resident cannot be removed by the restraint cannot be removed by the resident, B, the restraint can be removed quickly when needed. C, body alignment is maintained while wearing the restraint. D, it can be easily observed whether the restraint is applied correctly. So why do we use a slip knot when we're securing a restraint? What's the purpose? And the answer is B. We want to make sure that if there is an emergency, we can remove that restraint quickly. So when you think of a slip knot, think of the way that you tie your laces, your shoelaces. You make the little double loop and then you tie the two together. So that's how you're going to do your restraints. As a reminder, restraints cannot be attached to the side rails because the side rails move. Whenever you're attaching a patient, whether it's a catheter or restraint, you attach that to the frame that the mattress actually sits on because it's more secure and less likely to cause injury to your resident. 40. When using personal protective equipment, PPE, the nurse aide correctly follows standard precautions when wearing A. Double gloves when providing perineal care to the resident. Double gloving is not advised by the CDC, so it is not A. Although you may see it done, it's not supposed to be done. B, a mask and a gown while feeding a resident that coughs. C, gloves to remove a resident's bedpan. D, gloves while ambulating a resident. All right, so what's the next best response? If you're going to choose A, we know it's not A now. And so for this one, it would not be B either, because if someone's coughing while you're feeding them, that's more than likely they're aspirating. The food is going down into the lungs instead of into the stomach, and that's why they're coughing. If it just said a person was coughing, then yes, maybe a mask and a gown, but they're specifically coughing while you're feeding them. That's a sign of aspiration. So it's not B either. So the correct response, the most contaminating of all of those skills, would have been C. Whenever you're putting a patient on a bedpan, make sure that you have on gloves during the placement process, the cleaning process, and the removal process. Hi, Millie. Good morning. Great job, everybody. To help prevent residents' falls, the nurse aide should A, always raise side rails when any resident is in his or her bed. I'm going to stop you right there. Anytime you see an option that says always, wrong answer, because healthcare, patient care is individualized. We cannot treat every patient as we do somebody who's extremely confused and a fall risk. So in some of your facilities, if a resident asks that those side rails be taken off the bed and they're not a fall risk or a fall hazard, by law, we have to remove those rails. We have to get a doctor's order, but we'll remove them because your side rails can actually form a restraint. So we know it's not A because we're not going to raise side rails for everybody. B, leave residents' beds at the lowest level when care is complete. C, encourage residents to wear larger size, loose fit clothing. I have no idea how that's going to prevent a fall. D, remind residents who use call lights that they need to wait patiently for staff. Do you think your patients are going to wait patiently? I didn't either. So, process of elimination, the best response for this one is going to be B as in boy. And so, I could not find a good image of a bed that had a patient in it. But the reason why I want you to see the complete bed is because these beds, the adjustable beds, the entire frame of the bed can go up and down. And so, whenever you're providing care, you bring that bed up to a working height. But once you are done with your care, you have to lower that bed down to its lowest state. That way, if your patients do climb over the rails, because they do that also, there's going to be less injury. If you leave that bed high, then of course there's going to be more injury. And whenever the nurses come in to document, what happened, we're going to see that the tech left the bed high, and that's going to put you at risk of getting a write-up. And we don't want that. Plus, we don't want the patient injury. 42, as the nurse aide begins his or her assignment, which of the following should the nurse aide do first? A, collect linen supplies for the shift. B, check all the nurse aides assigned residents. C, assist a resident that has called for assistance to get off of the toilet. D, start bathing a resident that has physical therapy in 1 hour. What is your priority? Prioritization matters. And C, yes, 3 blessings, you got it. I know you all want to go get your supplies, but we only got one resident who called us. We need to make that person our priority. Otherwise, look at this lady. She's not waiting for you. She's about to get up, swaying backwards. I hate to say it, your day's going to start off crappy, pun intended, because there's going to be blood, pee, and poop on the floor plus a patient. So that's your priority. Anytime a patient has called, or if you have a test question that talks about a patient calling for assistance, we don't care what your other tasks are. You go to that resident first. 43, which of the following would affect the nurse aide which of the following would affect the nurse aide status on the state's nurse aide registry? That means it has to be something really bad, and also cause the nurse aide to be ineligible to work in a nursing home. A, having been terminated from another facility for repeated tardiness. B, missing a mandatory infection control and service training program. C, failing to show for work without calling to report the absence. Or D, having a finding for resident neglect. Which of those would be really bad? Yes, it is D. And so let's talk about that patient who was just getting off of the toilet without help. Because you went and checked on all your other residents first, this resident fell and broke her hip. So that would be a sign of resident neglect because you chose to do everything else except for help the person who was on the commode. And so you could be actually reported to the state and you'd be at risk of losing your CNA license. 44, to help prevent the spread of germs between patients, the nurse aide should A, wear gloves when touching residents, B, hold supplies and linens away from their uniforms, C, wash hands for at least 2 minutes after each resident contact, D, warn residents that holding hands spread germs. I reveal the answer in 3, 2, and 1. The answer is B, everybody. Whenever you're handling supplies and linens, you have to keep them away from your uniforms. So there is a contagious bug, it's called C. diff, that causes a very foul smelling diarrhea. And so if your legs touch the bed while you're providing care, and then you go to your next patient's room and your legs touch their bed, you're transferring that C. diff, that germ that causes diarrhea and vomiting, from one patient to another. And so it's really important that you keep everything away from your uniform. I'm going to backtrack so we can tell you why the other answers are not correct. A is not correct because you don't wear gloves when touching every resident. You wear gloves when touching the residents that would require you to wear gloves. For example, usually if we're just taking a pulse on a resident, we're not going to be wearing gloves because we would not be able to feel the pulse adequately. It is not C because according to the CDC, the Centers for Disease Control, you don't wash your hands for 2 minutes. You wash your hands for 20 seconds. And preventing the spread of germs between patients, to holding hands, what would be a better response is telling them to wash their hands after they get through holding hands versus telling them that holding hands spreads germs. 45, when a sink has hand control faucets, the nurse aide should use A, a paper towel to turn the water on, B, a paper towel to turn the water off, C, an elbow, and if possible, to turn the faucet controls on and off, or D, bare hands to turn the faucet controls both on and off. How do you maintain the cleanliness of your hands? Yes, yes, yes. Great job, ladies. It is B. We're always going to use a paper towel to turn that water off. 46, we're moving a resident up in bed who is able to move with assistance. The nurse aide should A, position self with knees straight and bent at the waist. B, use a gait or transfer belt to assist with repositioning. I just want to let you know now, gait and transfer belts are used with ambulation, getting them up out of bed, walking. It's not used with repositioning. C, pull the resident up onto one side of, pull the resident up holding onto one side of the draw sheet at a time. That's going to cause shearing. Your patient's skin is going to be shearing against that bed, so that's not a good idea. D, bend the resident's knees and ask the resident to push up with his or her feet. Okay. This resident can move with assistance. What is best for you and this resident? And the answer is going to be D. You would go ahead and lower the head of the bed, ask a resident to bend their knees. If you can, if the upper side rails are there, have them hold onto those side rails. And you're going to ask him or her to push with their knees, and that should help propel them towards the top of the bed. That helps save your back, and it also gives the patient some activity for the day. 47. The resident's weight is obtained routinely as a way to check the resident's A, growth and development, B, adjustment to the facility, C, nutrition and health, or D, activity level. Why are we weighing these patients every day? Like, why is your nurse harassing you for a weight every day? Yes, we need to be checking on our patients' nutrition and health. In this image, this person looks to be malnourished. And so, if they are losing weight while they are in our care, that's not a good thing. You're also going to have some patients with congestive heart failure. And so, if they start gaining weight, that's a sign of fluid or water retention that's going to make their heart failure worse. That's also not a good thing. So, when we ask you for those daily weights, it's so that we can monitor the health status of that patient. And again, if you just joined, this is Nurse Eunice with Florida Training Academy. We'd love for you to subscribe to our channel. 48. Which of the following is a right that is included in the resident's services offered at the facility daily, or D, to make decisions and participate in their own care? The Resident Bill of Rights. Revealing the answer. Good morning, Miss P. In 3, 2, and 1. It is D, you all. We don't get to tell these patients what to do. They get to participate in their care. It's, hey, Miss Jackson, how would you like your hairstyle today? Miss Jackson, what do you want to wear? Miss Jackson, would you like to eat this or that? So we want them to be making decisions for as long as possible, and you're going to help aid and protect them in their decision making. 49. Which of the following, if observed as a sudden change in the resident, is considered a possible warning sign of a stroke? A, dementia. B, contractures, which is like a fixated joint. C, slurred speech. Or D, irregular heartbeat. It is not D because you won't see an irregular heartbeat. Okay. That's something that a nurse can detect or that an EKG can show, but a CNA won't see it. Yes, yes, yes. So whenever there's a stroke, or if you think that someone's at risk of a stroke, I want you to think fast. And I'm going to type it in the comments over here. Fast equals face, arm, speech, and T, time to call 911. So whenever someone's having a stroke, there is either a blockage or a bleed in the brain. What the patient will exhibit, what symptoms or signs you'll see, is F, face drooping. One part of their face is not going to be symmetrical. It's going to be a little lower than the opposite side of their face. And sometimes they'll even be drooling. So we call that facial asymmetry, meaning that it's not even. One part is drooping down. A, asks them to raise their arms. Only one arm is going to be able to raise high. The other arm, not so. That's now because part of their body is weak on one side. S, ask them to say their name. Their speech may be garbled. That would be another sign of a stroke. And if they have any of those, T, if you're in the hospital, you press that code button. But if you're home, you go ahead and call 911 and alert the dispatcher as to what time these symptoms actually occurred. So great job, team. Think fast if you think someone's having a stroke. 50 is a hard one. Good morning, Anne-Marie. Considering the resident's activity, which of the following sets of vital signs should be reported to the charge nurse immediately? The problem with this one is they didn't label any vital signs. And these should be columns. So A, resting, 98.6, 98.32. Nothing's labeled. B, after eating, 97, 64, 24. What I can do is I'm going to give you a hint. A blood pressure looks like a fraction. So none of these are blood pressures. So if they are not blood pressures, what do these columns represent? The first column has a circle with a behind the number. So that first column going down must be temperatures. And in order for you to pass this part, you must know your normal range for temperatures. So I'm going to put it in the chat. And of course, we're talking about Fahrenheit because I don't know Celsius. So it's going to be a normal temperature is anywhere from 98 to, we're going to say like the low 99. So based off of that response, B does have an abnormal temperature, but it's abnormal after the person did what activity? It's abnormal after the person ate. And this person could have eaten something that was cold. So you wouldn't go and notify the nurse of that immediately. You would wait 10 to 15 minutes and then go back and recheck the temperature. Now, if it's still cold, yes, you can tell the nurse. So everybody is not B. Give me another response. If the first column is temperature, and we know that blood pressures look like fractions, so none of these are blood pressures, the last two columns must represent pulse and respiration. So what's the normal range for a heart rate or the pulse? Oh, I got you thinking this morning. I'm going to put it in the chat. If you don't know these numbers, this is something that you really want to start studying because you have to know your normals. If you don't know what's normal, you won't know when to notify me, the nurse, if something's abnormal. So we said that we're okay with temperatures between 98 to 99. Heart rate, you all, or the pulse rate is between 60 up to 100 in adults. And then respirations, everybody, it's going to be between 12 and 20. So with all of those numbers in mind, A has a resting pulse of 32. And we said that the resting respirations of 32. And we said that the respiration rate is 12 to 20. So this person is hyperventilating. They're breathing way too fast when they're not performing activity. Okay, they're just sitting there. That would be a medical emergency. So you want to notify your nurse ASAP because a person who is just laying there should not be breathing that fast. And so on this last sheet, if you didn't write down those normal ranges, I want you to go ahead and pick up your pens and paper and write down normal ranges now. So SBP stands for systolic blood pressure, and the range for the systolic blood pressure, I'll put in the chat, is 100 up to 140. So that's the top or the higher number of the blood pressure. If you can't pronounce it, go ahead and pronounce it with me. Say systolic. Okay, that's that high number. The second or the lower number of the blood pressure is called diastolic. So the diastolic blood pressure, that is usually between 50 to 80. So there we go. And then our heart rate, we said, or the pulse is 60 to 100. What's our respiration rate for adults? 12 to 20. And then our temperature ranges, We're okay from 98 to 99. No one's perfect. No one's like 98.6. No one's textbook nowadays. So, everybody, great job. Make sure you write those numbers down because you're going to see those numbers all throughout your career as a CNA. And I just want to say again, thanks for watching. I know I got on here really early, so I appreciate you for spending time with me. And I wish you much success. Enjoy your weekend, and I'll be back online next week, you all. Have a great day.